Good afternoon, ladies and gentlemen. This is October the 29th, 2020, special meeting of the Board of Supervisors. Madam Clerk, could you do a roll call and see who we have on the telephone?
Here.
Good afternoon, ladies and gentlemen. This is October the 29th, 2020.
Supervisor Johnson?
Present.
Supervisor Gould?
Here.
And we have Supervisor Watson and Chairman Bishop present.
Okay, thank you very much. On the agenda today, we have one and one only item. This will be a discussion of possible action, an update from the County Public Health Director to the Board of Supervisors regarding recent issues, actions, events, and county responses regarding COVID-19 updates and taking any necessary actions based upon the updates. We have Denise Burley, our Public Health Director, at the podium, and I'll turn the presentation over to you, Denise.
Madam Chair, members of the board, I will start out with the numbers. As of noon yesterday, we had 4,209 cases in the county to date, 220 deaths, 3,771 individuals have recovered. Average age of cases is 47.6. Average age of death is 75.9. So just some additional information. Mid-September to mid-October, our weekly number of cases averaged between 55 and 65. Week ending October 17th, we had 83. Week ending October 24th, 101. First 3 days of this week, Sunday, Monday, Tuesday combined, over 40. And then yesterday's number, I don't remember the exact number, so I won't quote that. But I think we're seeing a rise in the number of cases in our county at this point. And our epi curve on the website actually indicates that as well. Any questions there?
Denise, I do have a question. Are we meeting or exceeding our normal ICU capacity in the hospitals throughout the county?
Sure. In the hospital report, you'll notice that the number of ICU beds in use has gone up. There is a slight uptick based on our conversation with the hospitals, a slight uptick in COVID-like illness within the hospitals and ED visits and admissions into the hospital. So we're monitoring that, as I've mentioned in the past, very closely, as this is an indicator of stress on our hospital capacity and how that impacts the rest of the community.
Hey, is there any indication from the hospitals that they may be extending into their surge capacity?
We have not received any notice from any of the hospitals to that effect. We do and will be continuing to stay in close contact with them as we have weekly phone calls. So that'll be a question moving forward that we ask at each meeting to see how that's progressing on their part.
Okay, that's the only questions I have. Does anyone else have any questions of Denise?
Madam Chair,
Supervisor Angus?
that last comment about availability, it doesn't jive with what I just received today with bed capacity. Very, very low. I just don't want the public to get the wrong impression that the hospitals are starting to overflow with COVID patients, because that is just not true.
That is correct, Supervisor
according
Angus.
to the information we get right from the hospitals.
That's correct. It is not, they are not near capacity in any stretch of the imagination, but they are, there is an uptick, is what they've indicated to us in their ED visits, and as you can see from the number of ICU beds in use by COVID-19 patients, that number has gone up. You know, it's very gradual at this point, but that's what you also see out of our case count, is a gradual increase as well. So you would see a natural correlation between those two.
Again, I don't see it on the list. COVID-19 positive admissions per day.
Correct.
Yesterday, in one hospital, there were 3, 0 in the others. Mm-hmm. So maybe the uptick is the flu, and that, you know, do they automatically report that as possible COVID? Could that be why some of the other numbers are a little higher? I mean, we do break it down, just so the public knows, for influenza,
Sure.
which are a little low to me as well. So when you're talking about emergency beds, it could be everything, all emergency beds, not just COVID or even influenza.
Correct. When you're looking at the
All right.
emergency bed availability within these hospitals, it's not separated out as just COVID cases.
Okay, thank you.
Certainly, yes.
Madam Chair?
Supervisor Johnson, go ahead.
Thank you, Madam Chair. Director, when we get the PPE shortages, I noticed they're listing hand sanitizers. Just in case we get another increase in cases, are they going to be able to react with the supplies they have now, or are we still seeing shortages of the equipment that we might need?
That's a great question, Supervisor Johnson, and I don't have an immediate answer for you. So if you would like, I can certainly get back with you with a response to give you an indication of what we're seeing in terms of what supplies we're delivering currently and any challenges that they're facing either with hand sanitizer or other products as well.
All right, thank you. Yeah, I would just think by now we should be caught up. That's all, Madam Chair, Director.
Yeah, you know what?
Madam Chairman?
I'm curious about that too, because we've got the new hand sanitizer business in Golden Valley, so I've been watching this as well, thinking that's going to no longer be a problem, but I really,
And I've just been notified by our Public Health Emergency Preparedness Coordinator that we will be receiving hand sanitizer from the state on Monday.
great.
So that those materials, those items will be available for distribution out to those who have a need.
Okay. Supervisor
Madam
Gold?
Chairman.
Go ahead.
Madam Chairman, I was in the Kingman Walmart yesterday. The Kingman Walmart has a ton of hand sanitizer. They have it coming out of their ears. So if we have a shortage, I know where to get it. Thank you.
Okay. Thank you, Supervisor Gold. Anyone else? Okay. Go ahead, Denise.
Okay, moving on to the business benchmarks. Mojave County is currently in the moderate category, as we have been this entire time since this benchmark process started. As you can see, the number of cases per 100,000 for the last couple of weeks, especially last week reported of October 11th, was up. And you are seeing our percent positivity creeping up also for that last week. So we'll continue to monitor those benchmarks as well and keep you apprised of any major changes that occur. Okay. All right. So I believe you were sent some material this morning, and a question that's been asked frequently at the meetings here is, how many people are infectious right now in Mojave County? And so I have Mayor Schumacher on the line. She put together this report, and she would like to speak to it and go through this presentation. And if you have any questions, feel free to ask along the way.
Okay. Thank
And
you.
Mayor, are you on the line?
Yes, I am. Hello, Denise, Madam Chair, and Supervisors. This, as you'll see in the presentation, was a little bit tricky to figure out. We wanted to answer that question, but as we've mentioned before, we don't talk to every person every day while they're recovering, so it's a little hard to estimate. So have the slides started for you?
And I apologize, because I didn't forward the slides, but I do have them up on the podium here, so if we could go through them there. And I'll flip the pages as you go along, Mayor.
Okay. And are you able to show them? Otherwise, I'll open them up on my computer.
Show them, sorry.
To the camera, or
Okay, I've got them up right now. IT has helped me put them up,
Okay.
so whenever you're ready,
I
I've
just
got the
wanted-
first page, the cover page up.
okie doke. So as I said, it's a little difficult to calculate, and that's because we don't always know who's active or infectious, but we did the best job of estimating that. So on the next page, it shows how we looked at this and what the difficulties are. And the difficulties are that we only identify some cases. We know there are unidentified cases. We know some people are symptomatic and some aren't. The length of infectiousness is not clear, but we're using as an estimate 2 days before symptoms and 9 days after, which is the CDC way. And there's no way to account for visitors at all, so you're not going to see us do that here because we have no way to do that. But we have talked about in the past a lot, and you've all brought up the point that visitors can introduce, and they can be, infectious with COVID and here visiting. So this is just a one snapshot, one point in time, and it was October 12th, a couple weeks ago, when we were in that 55 to 65 cases per week. So on the next slide is our estimate, and the answer is at any given time in Mojave County on that day in October, there were 52 to 1,600 infectious residents with COVID. Now, the reason why that's a big range is because what it shows on the next page, which is that you have your confirmed cases, so we know how many confirmed cases there are. That one we can count and put our hands on. Then you have to count the unidentified cases, so the estimates of how many people were not, that we haven't tested, we haven't seen, but are out there infectious. And then you have another group of possibly infectious, and that's one you can count if you want or not count. I've broken it out for you so you can decide. So let's go through each of the pieces of this mountain or iceberg, whichever way you want to look at it. So the confirmed cases, as I said, these are people who are infectious, and they start being infectious 2 days before symptom onset and 9 days after. Now, if they don't have symptoms at all, it's hard to tell their infectious period, but we count that from the day they were tested just as an estimate. So we added up and took a look at who would be infectious on a given day, who would be ending their infection, who would be beginning, who would be in the middle, and that gives us 52 known infectious residents on October 12th. And remember, that's just our sample day. Today, since the cases are going up, that might be more like 62 or 72. But for that day, it was 52 on a given day. The next section then is how many people are roaming around out there who are infectious, but we don't know because they haven't been tested. And from the sources that are listed here, public health scientists are saying it could be 5 to 10 times more actual cases than those we've identified. So that means there's between 260 and 520 unidentified infectious Mojave County residents on that day. I use today as a shorthand for October 12th. Again, you could pick another day and we could apply it to another day. And that one on and remember, that's going to have a higher rate of asymptomatic folks because the asymptomatic would be less likely to get tested. The next group would be the actively infectious contacts of those folks. So if we estimated that every unidentified case has 2 contacts that haven't been tested yet, then there may be as many as an additional 520 to 1040 on top of the rest. Again, maybe you decide, I don't want to count those because those are a little bit more fuzzy. So you could either keep them in your count or not keep them in your count. So if we go to the next page, it breaks each of these out. So what we had on that day is 52 confirmed cases who were infectious by the best of our estimates, then 260 to 520 who were unidentified cases, people who hadn't been tested yet, who were infectious, and then we have the contacts who also could have been infectious added on top of that. So again, if you want to just count the unidentified and identified cases, that feels a little more secure, then you would go up to about 500 and you'd go over 1,000 and up to 1,600 if you're adding the possibly infected. We also did a little analysis on symptomatic. Denise, do we want to do that today or save that for another time?
No, this is fine.
Okie
That's
doke.
good. Okay. Any questions?
I don't hear anybody asking, so,
Yes, I do have
oh,
a question.
Supervisor Watson does.
We currently have 4,209 Mojave County residents that have contacted COVID-19, correct?
That's correct,
How many have recovered? I lost that number.
certainly. We have 3,771 recovered.
3,300?
3,771. That's as of noon yesterday.
Thank you.
Any additional questions?
Okay,
I guess not.
all right. Mayor, did you want to go on to the youth COVID cases?
Sure, be happy to.
Okay.
As we talked about a couple of meetings ago, we've been tracking the kids who are in the school age group. And again, want to emphasize some of these kids may actually be going face-to-face in school and some may not. So they aren't necessarily school-acquired COVID at all. We don't want to count that, but we just want to keep an eye on that age group. And this is what you see here. It's pretty steady and fairly low for now, and we're just going to keep an eye on it and see if any cases increase. So we're just using this as a baseline. We'll look at it at every 2 weeks. We can look at it every week if you'd like, but just keeping an eye on that age group.
Any questions there?
Anyone have any questions?
Just like to go back to a point.
Yes,
If I could,
Supervisor
please.
Watson.
Thank you. Ms. Burley, I can appreciate the presentation this morning and the estimate of 1,612 out there. But statistically, wouldn't it be also wise to include the difference between the people that have come down with it and recovered, which the number is 528? So in my point of view, or my reasoning, I'm looking for a number between 528 and 1612 as being the answer. Does that make any sense to you?
Mayor, can you
So there are a
respond?
couple, right. So there's some differences in those numbers. The numbers that you're looking at are just confirmed cases who were tested. And then also, this is on a given day, just on one day. The numbers you're looking at are over the course of the whole epidemic. So, and then also, to confuse it even further, recovered cases are those folks who have, that we have been able to contact and we've been able to close their case. Some of the people who are not yet in that count may actually be recovered, but we just don't know that yet. So those two numbers really are apples and oranges.
Thank you.
And also, this is a measure of who is infectious, not necessarily who is having symptoms. So recovery has some to do with that, whether they're done with the illness, whereas this just says who's infectious. Some of these folks may not even have any symptoms at all.
Did that answer your question, Supervisor Watson?
Thank you. I'll assume that the number is between 528 and 1612. Thank you.
Okay. All right. We want to update you on enforcement activities. And if you wouldn't mind just one moment, forgive me, I just need to grab the numbers as I left mine on the printer. Do you want to go through them?
I can.
Sure. Okay. Thank you, Madam Chair. I'll have Ron Balsamo go through this as he's much more intimate with the numbers around enforcement.
Okay.
All right, good
Thank you, Ron.
afternoon, Madam Chair, members of the board. So as of October 29th, we have inspected 16 gyms and 66 bars, nightclubs, restaurants. Still never received any complaints about the theaters or any water parks, so we have no inspections there. Total number of inspections for the gyms were 30. There were 8 re-inspections and 12 where we went to the third phase. With the restaurants, we had 60 second inspections, and we've had 20 that have gone to the third phase. And so just to compare that to a month ago, the gyms, stage 2 were 6, stage 3 was 12, and for the restaurants, stage 2 was 50, and stage 3 was 12. And so the percentage of complaints where we find the establishments in compliance at the time of inspection, 63% for the gyms, 44% for the restaurants. And so if you have any questions about those numbers or how we derive them, it's pretty straightforward. Just to, if we have to go out twice, that's a re-inspection. We have to go out 3 times. That triggers 2 more if they were found in compliance, and then phase 4 if they're not.
Okay. Any questions for Ron? Okay. Thank you, Ron.
Okay. I wanted to talk a little bit about the masks and some of the information that we've learned since our last meeting. And I believe you're aware of the information, the summary that's been provided to everyone around the employee survey. And what I'd like to show you very quickly is a very small snapshot of information, and this is something that was provided as part of a request from the City of Kingman. So I want to be clear and transparent about the reason for this. They were looking at their mask ordinance, mask proclamation, and they had asked us if we could break out percent positivity by community and put dates below, of course, of when their mask requirements went into effect and when they were rescinded. So I have a chart here, which basically, as you can see, shows that approximately 2 to 3 weeks after the Bullhead City community ended their mask requirement, we started seeing the percent positivity going up. We show the same for the city of Lake Havasu, and as you'll note, you'll see that Kingman was still continuing on in a decline, actually, in the number of the percent positivity. So, I recognize that there is a personal belief involved in this. There are also medical conditions, valid medical conditions and reasons that people are unable to wear a mask. And in those particular cases, I think we need to have some accommodation for those individuals in some way. But we know, and it's generally accepted, that masks work in terms of reducing the spread. And as I've mentioned before, they're not a perfect solution, but they protect others from anything I have, from anything you have. And that's really what we're trying to do in this whole effort, is to protect others. We recognize that there are a number of people who have passed away from the illness, and that number is significant, at least to me. So 220 individuals who, prior to this particular response and to this virus, were maybe somewhat compromised, maybe entirely healthy. It's hard to say. I mean, I think we know that a majority of those people did have some underlying health conditions, but prior to this virus, they were managing those. They may have been living with them quite well, while others were not. So we have a whole spectrum. But the point is, this virus came along and has presented challenges for those individuals. Our goal in public health is always to protect public health. That's our job. And in so doing, we'll continue to make the recommendation that people wear masks in our county building, in the community, and wherever else until we get a vaccine or some other form of long-term prevention approved by the federal government and out in the community. This is just a reasonable thing, I think, for us to ask. It's an inexpensive solution, and I just want to make that clear where we stand and where we'll continue to stand in terms of our recommendation.
Thank you. Does anybody have any questions of Denise?
Madam Chair,
Supervisor Angus?
I can't, on my computer, I'm sorry, I can't really see the date, but the spikes in Bullhead City and Lake Havasu City, were they around the holiday weekend?
Supervisor Angus, they were starting October, this is the point, October 10th, they started to jump up.
October 10th? Mm-hmm. Okay. So the holiday weekend, because it makes more sense because we get more visitors and then we get the snowbirds. So, the spike, again, it's all the way you look at it. Is it a little or a lot? Mm-hmm. What I'm liking to do better now is to look at the hospital reports. And because that, again, is how this whole thing started, was not to overwhelm the hospitals. Correct. And they're not being overwhelmed. If it got to a point again where they are, we can always start over. But I think we have to keep in sight what our original mission was. If it's to make sure nobody ever gets sick, that is not our mission. So I just want to put that on the record because I think Havasu and Bullhead will always have a bit more than Kingman because not just maybe because of the mask, because again, we don't know, but because we get more people visiting from out of town and we are a vacation destination. So thanks. That's all I wanted to say.
Okay. Thank you. Anyone else? County Manager Elters. Supervisor
Thank you,
Watson.
I do. Ms. Burley, the number of deaths have seemed to hold pretty steady over the last 6 weeks, I believe. I believe in the last 6 weeks it's run from about 208 to 220. Mm-hmm. What would you contribute that to?
What we're seeing is a lot of younger people becoming infected and a lot of mitigation strategies being implemented in long-term and alternate care facilities, congregate settings. A great deal more testing going on in those particular facilities, which is required by their funding agencies or insurance coverage. So they are doing a lot more in those facilities to prevent the illness, the virus from getting into their facility, and seeing younger people who are a greater number of younger people becoming infected.
Thank you. That's reasonable.
Okay. All right. County Manager Elters, did you want to report on the survey?
Certainly, Madam Chair. Good afternoon, board members. Consistent with the debate that is going on in the country and in the county, the board wanted to hear from the public and from our employees. So with that, the board held a public workshop where the public was invited to comment and provide feedback. Those came in the form of presentations in person or written. So 6 individuals presented to the board in person. 1 was in support of, and 5 were in opposition to the face mask policy. 46 people submitted written comments. 28 were in support of, and 18 were in opposition. So in total, the board received 52 comments, and 29 of those were in support, and 23 were in opposition, which equates to 56% in support and 44% in opposition. Moving on to the county employees survey, just as the board heard from the public, the board wanted to hear from our employees. So a survey was sent out to all employees, including the court system, and that was 1,279 active employees. We did have 614 returned, which is nearly half. Actually, it's exactly 48%, which for surveys is truly a terrific response. And we are, on behalf of the board and staff, I am very grateful for everyone who took the time to respond. So, of those the 614 that responded, 340 do not support or were in opposition of the policy. 274 were in support of it, which then equates to 55 in opposition and 45 in support, which is exactly the opposite of the public comments percentages that the board received. There were really helpful information related to the breakdown of those that support it, why they support it, and those that oppose it, why they oppose it. And I would honestly tell you, and I'm happy to get in the weeds on this and provide you all the information you want, but the feedback that the board received from both the public and our employees is certainly consistent with and mirrors the debate that is going on in our society today and in our county and each of our cities, which is a near split. Those that are for it and those that do oppose it, which makes me realize the difficulty and the dance that you, the board members, have to go through to make decisions when our society and our county and our employees are sort of divided right down the middle. So those are the results. I think they are valuable. I appreciate the public and our employees who responded. And that concludes my report, unless there are any questions.
Thank you very much. Does anyone have any questions on this?
Madam Chair?
Supervisor Angus?
Well, since you're looking at this percent-wise, sorry, I apologize for that. Since you're looking at this percent-wise, you're talking about 55 comments from the public out of a whole population of 200,000, whereas the employees are basically 50% of all the employee base. So it's really not apples to apples as far as comparing that they're both kind of similar. I think that the employees is a more realistic because that is truly a greater sample. That's it.
Supervisor Angus, your observations are on the mark. I was just sharing the numbers and the breakdown with the board.
Anyone else?
Madam Chairman.
Supervisor Watson?
Thank you, Madam Chairman. In light of the information that we've received, I'd like to make a motion to reconsider the October 19th, 2020 motion to rescind the mask policy for the auditorium for public meetings that became effective October 20th, 2020.
Okay, we have a motion on the floor. Is there a second or any discussion?
Second.
Second?
Okay, Supervisor Gold has seconded.
Okay, thank you. With that, I'd like to give some reasoning behind that.
Do we need to do the vote?
Pardon me?
Do we need to have a vote on that?
On the rescission? Yes.
Okay, all those in favor of the reconsideration motion, say aye.
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 Any opposed?
Aye.
Okay, motion passes. Supervisor Watson, continue.
Thank you, Chairman. I want to go over some of the reasons why I bring this reconsideration today. Number one, Mojave County is charged with providing essential service to the constituents of Mojave County. That's our job. We need to protect our fellow employees to the best extent possible. Where that is the case in most of the county buildings, the auditorium is somewhat different. The auditorium is a large enough space to allow for social distancing. And Mojave County has taken steps to ensure that social distancing takes place in the auditorium by the spacing of seats available. The auditorium is not used frequently as the other buildings and county spaces. And Mojave County has considered the thoughts and the opinions of the public and the employees while ensuring their safety. This decision is a balancing act of interest. Some of the public's desire to participate in the county public meetings in the auditorium without a mask, while protecting the health and safety of those who are present for the meeting and the health and safety of our employees throughout the building. So with those reasons, I'd like to make a motion to remove the mask policy for persons inside the Mojave County Board of Supervisors auditorium so long as they maintain social distancing, which we understand is 6 feet.
Okay, we have a motion.
Second.
We have a motion on the floor. Any further discussion or a second?
Second. Discussion.
Supervisor Johnson, go ahead.
Thank you, Madam Chair. I don't know that we've done any air circulation surveys or anything else on this building, or we've done it on any other buildings in the county to start picking and choosing which buildings we decided we're not going to use masks. If it's the will of the board to do away with mask policy in the auditorium, then I think we should remove the masks from all county buildings and remove the shields and everything else. If we're not going to do any protection, if we believe there's not a pandemic, then remove everything. Thanks, Madam Chair.
Okay. Thank you, Supervisor Johnson. Anybody else? Okay, we have a motion on the floor. It's been seconded. All those in favor say aye.
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 Any opposed?
Aye.
Motion passes.
Madam Chair?
Supervisor Johnson.
Thank you, Madam Chair. I would make a motion to remove the mask policy for Mojave County and remove all shields that have been placed.
Okay, we have a motion on the floor. Is there a second or discussion?
Second.
Supervisor Gold
I have a
has made a
discuss-
second. Supervisor Angus?
So I just to clarify, was Supervisor Johnson talking about all of Mojave County or just the building?
Supervisor Ingus, I don't believe there's a mask policy in Mojave County, only the
Well, I
Mojave County
mean, for
buildings.
like, it was kind of general, so I just wanted to make sure that it was just for the building. Or maybe I heard it wrong. Can you repeat the motion?
Madam Clerk, can you repeat the motion, please?
Motion is to remove all face masks and face shields from Mojave County buildings.
Okay. But the departments that put up, we're still doing social distancing, and the departments that put up the plexiglass, that all stays in place, correct?
Madam Chair?
I don't believe there was discussion of that. Supervisor Johnson, though, can you clarify?
Yes, Madam Chair, thank you. I don't see why we wouldn't remove those shields also. If we don't think there's a problem, then remove them.
Chairman Bishop,
Is
if
that
I
part
may.
of the motion?
Pardon, Supervisor Angus?
Is that part of the motion today, to remove every barrier? Because we are talking about masks, not social distancing and things that aren't worn by people. So if you are saying everything that we've done, no social, nothing, then I can't support that. And why take down things that we've already paid to put up?
Well, it's not part of this motion. No, I haven't added on, and I haven't asked for a second either on that.
Okay. So this is just masks and face shields.
Yes, ma'am.
Okay. Thank you.
Repeat the motion, please. Point of order.
Okay. Madam Clerk, could you repeat the motion one more time?
It was stated to remove face mask and face shields from Mojave County buildings.
And Chairman Bishop, just to clarify, so we're talking, and then I have a comment. So we're talking the masks, and then the shields that we provide to the public or that anybody else could wear, correct? Is that what we're talking about?
I believe that's correct.
Okay. I mean, a couple of things. One, the county attorney's office does not recommend you pass this motion. We've heard from the public health director to talk about the importance of masks. And I think Supervisor Watson here provided a compromise of sorts after hearing all the comments and beliefs from everybody. Supervisor Watson proposed a reasonable compromise that would allow some people to come into the auditorium without a mask as long as they social distance. I just don't think it's a good idea to throw the baby out with the bathwater. I just don't think that's right. And it's a position that we do not recommend that you take. I think you follow the recommendation of the public health director, who has explained on multiple occasions why you should have those masks. That's the position our office takes.
Okay. Do you believe that there might be some legal challenges if we were to pass this motion?
There's always. I mean, it's hard to forecast what's gonna happen. But when you're talking about liability, you've got two different parts here. You got one, our responsibilities and duties to the public. We have a duty to the public to make sure that our locations and spaces are safe and healthy. If we breach that duty, then there could be a liability. When we're talking about our employees, we also have a duty to them, but that's more in the context of workman's compensation. With workman's compensation, if an employee is injured while on the job, by accident, then we will have to pay. That's part of the insurance. We pay into the insurance program for workers' compensation. Right now, it's pretty difficult to get a workers' compensation claim through a COVID because of the community spread. It's hard to prove that the action took place on the job, because that's what you have to show for workers' compensation. But if you remove the mask and you do the things under a certain set of facts, if somebody can establish that the injury occurred while at work, then there could be an increase in workers' compensation. Now, again, I'm not saying that that's going to happen, but there is possibilities. I think the point that I'm trying to make is we should follow the recommendations of the public health officials who have recommended these things, and we go forward with these. It just doesn't seem as if it makes sense to disregard that advice. And so, yeah, it could expose some greater liability. But again, I can't say what it'll be because can't foresee the future, but it does, if we're talking about risk, it increases the risk a bit. Yes, it does.
Okay, thank you for that clarification. Any other comments?
Madam Chair.
Supervisor Angus?
So again, just because we're saying it's not required to come into a building, doesn't mean that people can't wear them if they feel that they would be safer or feel better or more secure wearing them. Even our employees. This is not a mandate not to wear. This is just it's your choice not to wear. That's it. And we do have, but keep the social distancing. So this is just about masks.
Are there any other questions or comments?
And just to be clear, a couple things, and our risk manager pointed this out, and I think he's absolutely right. You can't have the jail fall under this. You've got to have masks in the jail. There's a real issue there. Those are confined spaces of people where we have to provide adequate safety and health measures for them. And so my recommendation would be to, well, one, we already recommend that you don't pass the motion, but two, if you do, that you consider excluding the jail. Also, secondly, it does not include the courts. We already know that. The courts already require masks. Today, you go into a courthouse in Mojave County, you've got to wear a mask. And this isn't going to change that, at least for the Superior Court.
Sounds confusing when you're saying, one area of the county this motion would affect and other areas. So, adding more confusion. Supervisor Watson?
Madam Chairman, a question for legal. Mr. Esplin, if one of our departments were to be inundated with COVID-19, say a small, tight department of 10 people, hypothetically, and of those 10 people, each and every one of them came down with the COVID-19, and one person died, would there be enough conclusive evidence to bring a lawsuit against Mojave County?
Well, that increases the risk, certainly. It does. I mean, there's evidence there that it was spread within the department, and certainly I think a plaintiff's attorney would jump on that. Now, whether they would succeed or not, we'd have to see, but we want to try to avoid the lawsuit at the very start. But more importantly, think of the effect that it would have on that department. Think of the effect it would have on the county. Every department is important. You name a department in this county, every one is vital. And the small, the large, the medium size, if you take 10 away, I can name a couple of departments who that's all they have in there, and you take over more than half of their workforce away, that could have some ripple effects upon the county, crippling effects. That's the huge concern. We're concerned about health, and we're concerned about operating and making sure those are done. And then it ripples to the public. If one department goes down, then the public suffers because they're not getting services from that department. I mean, we're trying to serve the community. That's one of the reasons why and it's not just Mojave County. Businesses are doing the same thing. Businesses cannot afford to have their workforce go out. One of the biggest costs of business, I mean, you guys know this, is personnel. And if personnel are out, if they're sick, if they're missing work, then the cost to the business goes up. And then that cost goes to the public too. So you have a lot of ripple effects if a department goes down.
Thank you, Mr. Esplin. I have just one more comment, and then I'll be quiet.
Okay, Supervisor Watson, go ahead.
It is our responsibility, each and every person sitting on the dais, the 5 board members, to provide the essential service to the constituents of Mojave County. Now, if our employees are unable to do that, that responsibility lies on the shoulders of each and every supervisor sitting on the dais. just want to remind you that you're making a decision that could be very much affecting your future, as your responsibility does require providing those services to the constituents. Thank you.
Okay, thank you. County Manager Elders, did you want to speak?
Yes, Madam Chair and board members, and I certainly do not intend to jump in the fray and take sides. My comment focuses primarily on the employees and the fairness and the consistency. So I just reported to you we have 1,279 employees to whom we sent the survey. That consists of all county employees, including the court system. If you were to remove the face masks and shields from county facilities, that will exclude the court system. So we have now county employees, because the court system employees, as far as I know and believe, are also county employees. So we have two sets of county employees, one that has the mandate and one that doesn't. If you leave everything else out, legal liability and so on, and you just look at it from that point of view, and when you throw the jail in, I don't know what those numbers add up, but again, we have a substantial number of our county employees that fall under the mandate, and the rest wouldn't. And just as the county manager, I just don't think that is really fair, and would really send mixed messages to our employees. So I will end with our employees are our most valuable asset, and they're the backbone of any agency, private or public, and Mojave County is no different. Thank you for allowing me to speak.
Okay, thank you. And, you know, as chairman, I just think that if we remove the mask mandate in our county buildings, it would be irresponsible on many different levels. But, you know, agreeing that it's a personal choice, and that's important. But I think when it comes to the county, you know, people can choose to do business wherever they want to. They can go to whatever restaurants they want. They can choose what events to participate in, but they can't choose when they have business to do with county government or city government. And I think it's imperative that we try to keep our county buildings from becoming an unsafe place for our residents to come to, and I'd hate to see us become kind of a petri dish here, if that's probably not the right term to use, but we could become a place where this virus is spreading to the rest of our contingencies. I just don't think that's a good idea, and I think county manager is correct. We need to protect our employees, and we need to protect the public that come into this building and our other county buildings. And one last point is, I think it's confusing if, you know, we have this mandate in the jails and in the courts, but not in this building, but yes, in the city buildings. I don't know, consistency, I think, is where we've been, and I think it's where we should continue. That's all I have.
Madam Chair?
Supervisor Angus?
I think that Supervisor Johnson's have made that motion sort of off the cuff in response to our last one, more about safety and things like that. And you'll be surprised to hear that I even, you know, I understand the jail. That's a no-brainer. So I'm asking Supervisor Johnson if maybe we can put this on the agenda for Monday, and by that time, there can be some options for us from county manager that would take care of all of these questions that seem to be, you know, things that we aren't really considering if we open up everything. So that would be my suggestion.
Hey, Supervisor Johnson, did you want to speak again?
Thank you, Madam Chair. I guess my question first will be directed at the county manager and the county attorney. They talk about protecting the employees, but I didn't see either one of them stand up and want to protect the employees when the previous motion was made, when we have all of our directors that attend our meetings. Nothing scientific had gone into looking at the airflow or anything else in the auditorium. No other county buildings have been looked at. There's no input from the health director. I just feel if we're going to do this, then we ought to be consistent.
And if I could respond to that,
and that's why I made the motion.
And Supervisor Bishop, or excuse me, Supervisor Johnson asked that you hear from me, at least from my end. I don't like the motion that was passed. I don't. I'll say it right now. I wish that we would keep it, but I understand that there's interest and there's other people, and we're trying to balance the interest. But on my own personal level, I wish that we would continue to wear masks in the auditorium. I do. You know that. Everybody knows that. I ain't hiding it, but I understand there's a process, and I see the arguments that Supervisor Angus makes. I see the arguments that everyone makes, and we're representing the entire board and not one individual supervisor. I do. I get that. I wish that we would, but I'm not the voter. All I do is I'm advising, and the board has asked for my opinion on things, and I give that opinion. That's why. I think you're trying to, with this particular motion right here, I think you're throwing the baby out with the bathwater. And it's just, sometimes you win, sometimes you lose, and I don't think that it's a good idea to make a rash motion when you weren't on the winning side on something. I don't think that's a good idea.
Supervisor Watson?
Thank you, Madam Chairman. I'd like to clear up an issue for Supervisor Johnson, that our motion for the auditorium actually is consistent with our overall policy, in which it allows our employees to take off the mask if they have the ability in their office or workspace to distance by a distance of at least 6 feet. And that was one of my basic reasons to bring the original motion forth, was to be consistent with what we were already doing with our employees and be consistent with our constituents. So there is a consistency there. Thank you.
And if I could just chime on that, Supervisor Watson really hit it correctly. We're trying to be consistent. We're trying to be consistent across the board, trying to be fair to everybody, considering all interests that are involved, but be consistent. Because as Supervisor Watson points out, if you go back to the original motion that was passed, which we found back on July 2nd, the original motion that was passed is for the Mojave County employees to be required to wear masks when dealing with the public and when an employee does not have the ability to social distance with coworkers. So right now, as long as the employee can social distance, then they don't have to wear that mask if they're not dealing with the public. So that we're trying to be consistent, just like as Supervisor Watson said.
Madam Chair?
Supervisor Johnson?
Thank you, Madam Chair. I have a question for the Director Burley.
Yes, Supervisor Johnson.
Thank you, Director. My question is, we talk about masks, and we're saying, okay, the people can still choose to wear a mask in the room you're in right now, the auditorium. But isn't the purpose of a mask is for me to wear it so that I don't spread things to you? So the idea, if I want to wear a mask and nobody else wears a mask, they're not as effective. Would that be correct?
That is correct, yes. Their primary purpose is to protect the people around you.
Thank you, Director. That's what I'm getting at, Madam Chair. I'm just saying, if we're not going to do it in one room, then don't do it in any room. It doesn't make any sense to me to start picking and choosing. We already have picked and chosen, so why not just do away with it?
Madam Chair?
Supervisor Angus, go ahead.
I understand why Supervisor Johnson has done that. I think this is clearly in response to our last one. Kind of appreciate his thinking. However, any motion that includes the jail in it, I can't support. The jail is a whole different thing. It's run by a contract medical company, and I couldn't support it unless we did a carve-out for the jail and then heard from the courts, too, like how it would affect them. So, again, I'm not saying that I don't support that, but I think that there's some more thinking that has to be done into it, because it's going to affect people and buildings that we maybe not really have that authority over. So it just has to be, there has to be more research done.
Madam Chair?
Yes, go ahead.
Thank you, Madam Chair. Supervisor Gould, I don't know if you would be willing to amend your second. I would change the original motion to exclude the courts, which we have no control over, and I don't believe we have any control over the jail either, but I would exclude the jail also.
I'm amenable to that.
Supervisor Bishop, may I ask a question?
Yes. Supervisor Gold, I wasn't clear on what you said.
I am amenable to the changes in the motion.
Okay, and this would also then include the sheriff's office as well? Or not? That's what I mean, we're picking and choosing now, and it's already getting confusing on our level, let alone the level of our citizens. Denise, did you want to speak?
I did, and thank you, Supervisor. I would also ask that departments have their discretion to make that requirement, as we will be making it in public health.
Okay.
Madam Chair.
County Manager, go ahead.
Supervisor Johnson kindly commented earlier and asked why I did not speak up, so if I may just offer a couple of thoughts.
Yes, please do.
One related to and that is specifically related to the motion about the auditorium being singled out. So the auditorium has a capacity of over 250 persons when it's full. With the layout that we have in it now, we can only fit about 50, in fact, about 48 people, because we've got seats blocked where people cannot sit. So the larger space, the higher roof, the social distancing that is available, at least from my point of view, is considered. The other related to our back to our county employees. So, forgive me. Let me go back to the auditorium for a moment. The public comes to the board meetings. They have an option to come in and be present here in the room, and if they don't feel comfortable, they can watch it from home because it's live streamed. Related to our county employees, they do not have that option. They have to be here in order to provide the services and perform the functions that are required of them. So, with all respect to all supervisors and the debate that is taking place, I offer these thoughts. That's really the reason that I did not chime in and say anything. Those are my thoughts and reasons for it. Thank you.
Thank you. Any other comments before I call for the question? Okay, we have a motion on the floor. It's been seconded. All those in favor, say aye.
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 Any opposed?
Aye.
Aye. Madam Clerk, do you have the vote, or do we need to do a roll call?
I have the vote. Yes would be Supervisor Hilda Angus, Supervisor Gould, and Supervisor Johnson. Nays are Supervisor Watson and Chairman Bishop.
Okay. Any further comments or discussions? Denise, do you have anything more?
So I just want to clarify, do departments have that discretion within their department to require masks?
I think the motion was to remove our policy of requiring face coverings and shields in county buildings, excluding the jail and the court system.
Madam Chair,
Yes.
if I may, to answer Denise's question, unless, as a county manager, unless I am directed by the board otherwise, I believe I have the authority to empower the department heads to take the proper steps and policies for their department related to the whole discussion of the virus. So again, unless directed by the board, I will leave this room today with the understanding that I do have the authority to empower the department heads to act in the best interest of their department. Thank you.
Madam Chairman,
Supervisor Gold.
I don't believe that the county manager has the authority to force members of the public to wear masks in the county buildings.
That wasn't the issue.
Okay. Mr. Espman?
What I would recommend, one, I agree with County Manager Elters in terms of his authority over his employees. So I would recommend that it's to his employees. He can control on how he wants to decide his employees. And so what he's going to do, or what he can do, is he can direct his departments as it relates to his employees. I wouldn't recommend that he go as far as the public, but I think he can certainly to his employees and say, hey, like what Denise, or excuse me, what Director Burley is pointing out, she would like to have her employees wear masks, and that's certainly within the ability of the county manager to do.
And Madam Chair,
Yes.
since it was my statement, I just to clarify, that is indeed my intent. I recognize the limit for my authority. I had no intention to make any decisions that would impact the public. I do not have that authority, but when it comes to county employees and their department heads is where I believe my authority lies. So yes, indeed, to clarify, this does not impact the public.
Supervisor Bishop, one additional question. In our clinical services unit, where we are providing medical services, I would ask that we allow and require us to allow our patients to wear a mask when they're coming in contact with our clinical providers.
I think that's consistent with what you have to do for your health and for your profession, what you're doing when you're providing services. When I go into a health clinic, I expect that my healthcare provider to wear a mask, and the healthcare provider to require me to wear a mask as well. And so I think that's understood.
Just wanted to clarify. Thank you.
Okay. Is there anything further before I close this meeting? Okay, meeting is adjourned.
Ron Gould.
Has left the conference.
Hildy Angus.
Has left the conference.